Did you know that psychedelics have been shown in plenty of studies to assist people who have a history of PTSD, major depressive disorder, and anxiety? Also, DMT naturally occurs in the human brain and is possibly the strongest psychedelic known to man and the active ingredient in a psychedelic known as ayahuasca. Also, it has been shown that when we produce some of the highest levels of DMT naturally, it typically occurs when we are in a dream state or right before we pass into the afterlife. So why in this video discuss ayahuasca and magic mushrooms, you might be thinking? Well, the main purpose is because they're two natural psychedelics that are becoming a lot more popular. And the best part is there is plenty of research that is suggesting that they have a vast majority in range of therapeutic benefits. These findings have led to greater acceptance of these potent substances in recent years. So here's some questions we can ask ourselves in part one. So how do they work? What are their effects? And is one better than the other? We are now going to take a look at some of the similarities and differences and look at this kind of as a head-to-head comparison in regards to ayahuasca and magic mushrooms. So real quick, let's start with a brief overview with magic mushrooms. So the term magic mushrooms refers to any fungus that contains the active compound psilocybin, which is the primary substance of giving you that psychoactive effect in magic mushrooms. And also, there are at least 180 different species that are grown in various regions around the world that can be consumed. People a lot of the times will refer to these magic mushrooms as shrooms. However, you do need to be careful because a lot of times, if you're not an expert in this field and you just go try to pick some, you could be eating a toxic mushroom. And now, real quick, so let's go with another part. And this is what I'm just going to go ahead and start. That will be leading into this part will primarily focus on part 2 of the video. Humans have used magic mushrooms recreationally and particularly ritualistically for thousands of years. However, it is only in the last few decades, or even really past 5 to 10 years, that we have become a lot more aware of their therapeutic potential. A lot of the modern research suggests that psilocybin, the primary active ingredient, once again, in mushrooms, could help with a variety of conditions, including depression, anxiety, OCD, and addiction. And that is what part 2 will be discussing. So wait for that video to come out sometime in the next, as I said, probably 3 to 5 days. Also, scientists are also exploring the potential of psilocybin to be a treatment of cluster headaches and migraine. So this will be a really good part 2 video. But remember, we're focusing on part 1, just the similarities and differences between the two. Now let's go into ayahuasca, a brief overview. Ayahuasca as well as a psychedelic, but it is a brew that originated in the Amazon. The people who found it were indigenous people that had been using it for centuries for spiritual and ritualistic purposes, and now it is becoming more popular elsewhere. The blend is typically, it's a tea. The blend also compromises several different plants, although the key ingredients in these are typically, there's multiple, and there's one, Psychotria viridis, also capi is another one. There's multiple, but the most powerful one we know to date is dimethyltryptamine, which is DMT, and that is the primary psychoactive substance in DMT that can make it a lot more powerful than even like magic mushrooms. So research into ayahuasca's benefits suggests that the combination may be useful for treating depression and addiction. It may also promote a process known as neurogenesis, assisting with regenerating new brain cells. So making your brain, once again, which we've talked about in prior videos, neuroplastic, making it change in a positive way. So real quick, let's take a closer look at mushrooms versus ayahuascas in terms of the active ingredients. And bear with me, a lot of these terms, a lot of these compounds are very hard to actually say, but we'll go with what we can. So as we mentioned, magic mushrooms, known as shrooms, contain the active compound psilocybin. That's the main compound. Once again, let's compare that to DMT, the active compound DMT, dimethyltryptamine. So with this, the chemical has a certain chemical structure to serotonin, and it binds with its receptors in the brain when referring to magic mushrooms. Primarily, psilocybin binds with serotonin receptors known as 5-HT2A to produce its psychedelic effects. So once again, magic mushrooms, shrooms, the active ingredient psilocybin, it's binding to your serotonin receptors, okay? Now, real quick, let's compare that to ayahuasca. The chemical makeup of ayahuasca is far more complex than that of mushrooms, and that's what I was trying to say a little earlier. When we look at the active compounds of ayahuasca versus psilocybin, there are some significant similarities. However, the chemical makeup of ayahuasca is far more complex than that of mushrooms. So you might be asking, what is the active chemical in ayahuasca? Some would consider the most important ayahuasca chemical to be, which we discussed, is DMT. Like psilocybin, it binds to the 5-HT2A receptors in the brain to produce its effects. It also binds to other receptors such as sigma-1. So with both of these compounds, magic mushrooms and ayahuasca, they're both attaching to the 5-HT2A receptors in the brain. Okay, so that is one similarity. Real quick, with ayahuasca though, however, unlike psilocybin, the body breaks down DMT very rapidly, which essentially means in its pure form, the drug's effects last anywhere from 15 to 30 minutes. The other ingredients in ayahuasca prolong the DMT's effect significantly. They can extend the experience for as long as 5 to 8 hours. The compounds responsible, and the compounds responsible for this and making it longer are harmaline, so it's harmine, then harmaline with an L, and tetrahydroharmine. So they all have harmine in them essentially, which make it last even longer. Also a note, as I said earlier, ayahuasca is a lot more potent than magic mushrooms. So the three chemicals I just stated, these chemicals work by inhibiting the enzyme of monoamine oxidase, which is MAO. You might have heard of an MAOI inhibitor, which is a medication. So it inhibits the MAO, which is responsible for metabolizing DMT. Moreover, these MAO inhibitors slow down the breakdown of the crucial neurotransmitters like serotonin, contributing to ayahuasca's antidepressant properties. So on top of it, ayahuasca can have antidepressant properties. So while DMT is unquestionably a critical component of ayahuasca, it also has other ingredients that play a vital role. And depending on the brew you have, you can have different brews that have different effects on you. So ayahuasca versus mushrooms, let's go to the effects again, just to kind of summarize in this way. Since both ayahuasca and magic mushrooms interact with the 5-HT2A receptors in the brain, they produce somewhat similar effects. However, there are some subtle differences between the two, as stated. And I've already said one stronger than the other. So let's start with the physical and mental effects of ayahuasca. People tend to take ayahuasca for its mental effects. It produces perceptual alterations and enhances your mood. In particular, once again, the active compound DMT in ayahuasca is famous for inducing those mystical experiences that some describe as a spiritual awakening. Many describe having a greater connection to other people or oneself and nature. It can also increase one's rate of thinking and provide insight into personal matters. Ayahuasca also can cause auditory and visual hallucinations, including, which is what I really want to kind of talk about, sharper colors, shapes and sounds, vibrations, moving patterns, closed eye scenes and visions. And also, many people do enjoy these psychedelic effects. However, some ayahuasca effects are less desirable. These include things such as disorientation and anxiety. Also, the brew can cause various physical side effects such as increased heart rate, changes in body temperature, and unusual sensations such as tingling. So you have to be very careful when you take it. That's why you should, if you are going to use it, typically a shaman would provide some assistance for you, because you probably will have some of these negative side effects if you use this. So moreover, some of the most common ayahuasca side effects include, and this is actually very important, some of the ones I jotted down are nausea. Vomiting is number one. Most people vomit the first time they take it. Nausea, vomiting, and diarrhea. However, people view these effects as a cleansing, or more so as it's a cleansing to get whatever that trauma-based feeling or whatever is going on in your life. It's a cleansing to get out of yourself. So a lot of times they say that with vomiting or diarrhea, it's a way of clearing the mind and soul. Also, these effects begin within 30 to 60 minutes of consuming ayahuasca, peaking after 1 to 2 hours and lasting 5 to 8 hours. Also, I'll just say this, there are some types of ayahuasca that can kick in just like that. There's also something called the toad, which I might do a video on in the future, where you take it and you're just gone for a good 30 minutes. But now let's jump into real quick the physical and mental effects of magic mushrooms. Magic mushrooms' effect on the brain or mind is quite similar to that of ayahuasca. They tend to amplify the mood of an individual, which that's kind of, once again, the same with ayahuasca. Amplifies the mood. You're more in tune with your surroundings. Therefore, using mushrooms while in a negative frame of mind could result in a challenging experience, which could be known as a bad trip. So that is really important, that when you do use anything like this that can have a psychedelic aspect, you need to go into it in a state of mind of accepting what could be coming, because if you don't, you might have a bad trip. Also, however, consuming mushrooms while in a good mood can include feelings of euphoria, relaxation, and connection. Like ayahuasca, magic mushrooms can alter one's sensory perception. So you're going to have some of the same psychedelic effects. Sharper colors as stated, halo or rainbow moving objects around them, geometric patterns, things like that. Some people actually mention that they've seen these elves. That's a very similar, similar and common aspect of using hallucinogenics like this, seeing elves. It's called the elves. So if you see that, that's apparently, that can be common, which in part 2, I'll discuss my own reaction when I did magic mushrooms. I've never done ayahuasca though. The physical side effects of psilocybin, which once again, as stated above, we'll compare to ayahuasca. Psilocybin is with mushrooms, DMT is with ayahuasca. So the psilocybin, aka mushrooms, some of the side effects include altered heart rate and blood pressure. It can either go up or down. Changes in body temperature, tremors, altered tendon reflexes, dilated pupils, and loss of coordination, and obviously nausea, headaches, vomiting can occur as well. And these effects begin 20 to 60 minutes after ingestion, peaking around 1 to 2 hours after, and lasting 3 to 6 hours altogether. Once again, it depends on how much you take of the magic mushrooms. So real quick, kind of to summarize, to go into the last aspect that I wanted to, let's go into ayahuasca versus mushroom safety and legality of it. So while both substances are relatively safe, there are a few precautions to consider, as well as the side effects we listed above, which both ayahuasca and magic mushrooms can interact with other drugs. That's huge. So here would be, for example, it is potentially dangerous to consume mushrooms alongside drugs that affect the central nervous system, the CNS system. These include alcohol, Adderall, Xanax, and some antidepressants as well. Meanwhile, also, the list of drugs that interact with ayahuasca is longer still. So even more with ayahuasca. So it includes blood pressure medication, appetite suppressant, medication for asthma, bronchitis, respiratory disorders, vasodilators, central nervous depressants, antipsychotics, antidepressants, tramadol, alcohol, and antipsychotics. So you need to be a lot more cautious if you're going to use this, and you should speak to a medical provider before if you're going to partake in trying this. So just always be safe. Ayahuasca can also have adverse effects when taken with certain foods, such as cheese, yogurt, chocolate, beer, wine, and coffee. So therefore, experienced users recommend that you should, and this is the big part, that you should fast 12 hours before using ayahuasca, because a lot of times individuals taking prescribed or over-the-counter medications, if you've never used it before, you can have a lot more of these side effects. So this is why you should consult with a physician if you're going to do this, and you should abstain from eating really 12 hours beforehand, and abstain as well from any other psychedelic use prior to going into using ayahuasca. Okay, which means don't use any other hallucinogenics for at least 24 to 48 hours before using it. Real quick also, it is, as I said, it is especially important to pay attention to one's mindset and the environment in which the experience takes place. This is huge. Having an experienced and trustworthy individual, as I said, kind of a shaman, individual on hand to provide support is also advisable. Ideally, this should be a professional and a licensed therapist or a shaman. Beware of the illegitimate ayahuasca retreats where self-proclaimed shamans, and this is why you got to do your research. There are shamans that do actually that do know what they're doing and have experience, but the ones who are self-proclaimed and have no credentials of it, a lot of times have been known to take advantage of clients, so in many ways. And also, finally, it is essential to note that both psilocybin and ayahuasca are illegal in most places, so you got to be very cautious about that. However, there are some exceptions, such as ayahuasca use as part of the specific religious ceremonies. So there are specific kind of laws within laws to where you can, if it's for religious purposes, you can actually use ayahuasca in illegal states. But that real quick, that sums up part one between the key differences that I jotted down between ayahuasca and magic mushrooms. And watch out, part two, again, we'll be covering things such as, we're going to be covering a couple studies that show how it can affect individuals who suffer from trauma, anxiety, depression, OCD, you name it, and how it has been life-changing for people and made a huge impact in their life positively. But I wanted to put this part one out here just so you're aware that, once again, this is drug education and you have to know what you're doing. It's not a game you want to get into where you take something and you've not done your research beforehand and you have a horrible trip. All right, I'll see you all. Please like and subscribe to the channel. You all know what to do. Leave a comment. Tell me about your experience. Tell me if you have any other questions about it. But part two will be coming out sometime in the next 3 to 5 days. I love you all. This is your daily dose of mental health with Adam, and we'll keep popping these videos out left and right. Let's go.